Hi, it's Paul. This is a pleural fluid on a 69-year-old female. We had no clinical history and it was a large volume, cloudy yellow fluid. So what did you think about this case? What did we see? Two populations, I think, were pretty obvious. There were small mesothelial cells that had nice sort of lacy borders and that cell-cell apposition in between them, little windows. As well as that, we had other atypical cells. In the diff-quick stain slides, these appeared quite different. They seemed large. They had very large clear vacuoles in most of them and slightly enlarged nuclei that were quite eccentrically placed. In the air dryads, the cells, the atypical cells, were usually arranged in small acinar-like groupings with the nuclei pushed right out to the edging of the group. In the pap stain, which was a treated pap slide, so it was sort of much more cellular, there appeared mesothelial cells, but then also quite different cells that were present in quite cohesive cell groupings. These appeared fairly organized with uniform nuclei and were really in what I would describe as like a flat sheet with a community border. So a nice smooth, not scalloped edge to the cells. In some of them, there may have been some yellow mucin, and you could see some palisading along the edge of the groups as well. So these are almost endocervical looking. So this can be quite a tricky presentation, and in my experience, it's one that's seen most commonly in acidic fluids in patients who have metastases from gastrointestinal primary tumours. And the diagnosis is more difficult because it's primarily an architectural one rather than relying on nuclear details. In this case, the presence of those large groups with a flat community border stood out from the mesothelial cells that were obviously mesothelial and having little windows in between them, etc. So in this case, identifying two populations really was helpful. A feature that's probably not always helpful, but in this case, that was really the key to the diagnosis. So our provisional diagnosis was metastatic adenocarcinoma. We had a cell block and did a panel of stains on that. I'll just show you a couple of the positives. So the epithelial membrane antigen showed nice diffuse cytoplasmic staining, and the claudin-4 showed that nice membranous positivity. So that was certainly consistent with metastatic carcinoma. We did a panel of stains looking for a possible indication of primary site. However, none of these were positive. So our final diagnosis was metastatic adenocarcinoma. So I hope you enjoyed that case. Thanks for watching.